Welcome back to New York Links. This week, in countries around the world, we recognize and celebrate World AIDS Day. More than 2 million AIDS-related deaths have been reported globally in 2008. 2 million children under the age of 15 now live with HIV. We attended Brooklyn's World AIDS Day events and spoke to Yvonne Graham, the deputy borough president, about her learning of HIV/AIDS 21 years ago and what progress has been made to combat the disease.
I remember working as a nurse in the emergency room at Brookdale Hospital when we saw the first case of what we now know as HIV and AIDS. We didn't know what it was, but the person looked deathly ill. We knew it had to be something infectious. The man died that night. And I moved on to form Caribbean Women's Health Association, and our flagship program was a maternal child health program to deal with pregnant women. But I remember a gentleman walked into my office. I believe he was from Haiti, and he said, "Well, Miss Graham, I'm hearing something on the radio, and they're talking about this thing on TV, but what is it?" And when he said it, I knew that the community wanted to hear it from a community-based organization.
Other political officials commented on the need for more funding and awareness campaigns, especially in Bed-Stuy and Flatbush, Brooklyn.
We work with HIV/AIDS organizations in helping to publicize their efforts and in bringing consciousness to make sure that the public understands HIV/AIDS is not gone. A lot of people in the community believe it's gone. But the truth of the matter is it's not gone, and people are still being impacted, infected by it, and there has to be a level of consciousness about preventing HIV/AIDS, and that's especially among our younger kids over and over again, that has to be emphasized that this can be 100% preventable if you take the right personal actions, and that's part of what we do here.
The funding that comes into New York City, that Brooklyn is not being treated fairly, and we're going to have to continue to speak out and work to make certain that Brooklyn gets its fair share.
So how do we get to the young people and the people who are being tested positive every day? The rates is going higher. How do we get to them, sir?
I think we have to constantly remind them that if they get treated, that they can live a much longer life. And if we encourage that and let them know that if you test positive, you need to seek treatment. And we need to begin to talk more and more about it. And also to talk about prevention. We need to let them know in terms of how important it is to protect themselves, to make certain that they do not become HIV positive.
21 years and that we've made a lot of progress is something that I'm very heartened about. However, I'm still very disheartened that right here in Brooklyn, though we're proud of so many things, Bedford-Stuyvesant and that central Brooklyn area is the epicenter of the AIDS epidemic. And when you look at the funding that's coming in to address HIV and AIDS, it's not commensurate with the need. So I believe that as elected officials and as government and policy makers, we have to ensure that the resources are brought to the areas that need them most, and that's a part of the fight that we have to do.
There is this tendency in government that money does not necessarily follow the need. It follows the power and those who make it happen. And so we have to be able to influence those who have the power. They have to recognize that resources need to go where the problems exist.
The AIDS Memorial Quilt was on display to illustrate the enormity of the AIDS pandemic and to increase awareness of the HIV and AIDS throughout the general public.
The population that we work with are criminal justice involved individuals who have mental health and or substance abuse issues. And one of the things that are prevalent amongst that population is being at risk or having HIV or AIDS. So we thought that it was important for us to observe World AIDS Day and have them come out to see the quilt that we have that represents people who have passed from the disease, to offer free testing. We've had presentations from clients who've been affected by it, so we thought it was important for the community to bring it out.
AIDS/HIV literature and condoms were distributed, and testing and counseling were part of the day's events as well.
And you're going to get tested today?
Yes, I am.
How do you feel about it?
I'm a little nervous.
Have you been tested before?
Yes, I have.
And you've tested negative?
Negative, yes.
So you're doing this to protect yourself and your partners?
Exactly, yes.
So you're a little bit nervous, but I'm sure you're going to be all right, right?
Yeah, but you know, just never know, you know. I have unprotected sex up within the past, and just to make sure I'm safe and my partner's safe. So, you know,
What would you like to say to the people out there in terms of becoming aware, getting tested and so forth? What would you like to say to them?
Just learn your status, get tested, you know. Basically, wear condoms to protect yourself.
But I still have to urge everyone to make sure, because it is their individual responsibility to carry the AIDS prevention message forward. HIV is 100% preventive. If you don't know your status, get tested. If you know your status, get treated. And that's my message for today.
Gifts. Who wants presents?
The Caribbean American Outreach Association, USA Incorporated, is a nonprofit organization headquartered in Brooklyn, New York. Their mission is to provide sensitive health and social support services to Caribbean American immigrants in the United States of America and the Caribbean who are infected and affected by HIV/AIDS and other health issues, as well as education. Greetings. I'm here with Dr. Jeff Birnbaum. He is the director of the FACES program. How are you doing today?
Hi, how are you?
I'm doing good. Thank you for asking. Now, tell us a little bit about what goes into an event like this or a program like this.
Well, every year we try and throw a big holiday party for the kids that come to our program. We take care of a large number of HIV-infected children as well as teenagers. This party is for the younger kids, their brothers and sisters and their parents. And we also have kids who are HIV negative, but there's someone in the family, usually a parent, who's HIV positive. And we try and have a nice party for them once a year.
Now, how do you go about selecting which kids you induct into the program?
Any kid who was born in the hospital is basically someone we follow, and we also take referrals from outside, but the moms with HIV deliver babies in the hospital, and most of the times these days, due to medications we have available, babies are not infected, but some of the older kids are still HIV positive, but on treatment.
Are there after-school programs for these children? Are there different types of I guess things that they could go to as opposed to?
Well, this is a big event for us. Every summer we try and send the kids to summer camp. There are a couple of different camps that we use that specialize in kids with chronic diseases, HIV being one of them. We sometimes take them on trips throughout the year. We take them on bowling trips, movie night. We have support groups that go on throughout the year. And we try and make it fun.
Now, you mentioned the support groups, and I want to touch on another point. You were talking about the privacy earlier. What goes into actually not revealing who these people are and protecting their privacy, so to speak?
Right. Well, unfortunately, HIV is still a very stigmatized disease, as we were talking about earlier, and people don't want their private business, on television, or just people around the neighborhood, friends, neighbors, sometimes people within the same house. Not everyone knows that there's a person with HIV living in the house. Sometimes the kids don't know they're HIV positive until parents feel that the kid's old enough to understand what it's about and not be frightened of it. And quite often that can go on for many years before we can work with the families to let the kids know that they have HIV.
But what are some of the things preventive-wise that we can do to guard ourselves against HIV? Well,
Safe sex. Everyone should wear a condom if they're sexually active, that's for sure. There's no stigma around condoms, and it's the only safe thing that we can bank on for sure. If women are pregnant, they should be on medication for HIV to prevent transmission to the baby. Everyone should get tested. If you've never been tested, you can't definitively say you're HIV negative. Everybody out there should get an HIV test.
Thank you so much, Doctor. Have a great time today.